Good afternoon, friends. So today we will be talking about what is the advantage if a student joins a coaching institute in the second year, specifically DBMCI. We get lot of queries on this particular part, that what is the advantage that you will gain if you will join in the second year MBBS. Okay. Now let's take a very small example, that two students of same caliber are preparing for anything, and one is working hard for 4 years and one is working hard for 2 years or 1 year. Now I will not say that the one who is working hard for 1 year or 2 years will not get success. He can get a success, but the person who is working hard, person who is oriented for 4 years has definitely much more chances of achieving the dream in a much easier way. Okay. So we will learn this from the best faculty of pathology at Pan India level, Dr. Praveen Kumar, and he will be talking to us that how it is different to learn pathology in a second year MBBS and how it is different if you learn later. Dr. Praveen.
Hi friends. Sir, I think we have three main courses in pathology. One is general path, one is hemat, one is systemic path. Friends, all of you will agree that we start reading pathology from Robbins.
Agreed.
We have underlined each and every chapter from chapter number 1, 2, 3, 4, 5 in Robbins. By the time we reach hematology, we start reseeding Robbins, and then we start with the next book. And we all know what that next book is.
I agree.
So the problem is, the next book is not able to give us concept. The next book is not able to give us the right answers to our MCQ that is asked in the PGM exam. What I firmly believe here is, the only time to read pathology is in second year. Because it's a very vast subject, you cannot read pathology in final year. Definitely not possible in internship. However well you have read pathology in second year. So I always believe when you start early, as you said, it's easy to finish early.
Yeah.
Now, I have seen students who think they know pathology, and then when they come with the concept that they have, it's completely different from what actually it is. I would like to show you some of the concept that we can actually get it in the classes.
Yeah, please.
Sir, I'll show you.
You teach pathology in the regular batches also, like we do that. We do pathology for 5 days.
Yeah.
So how your pathology that you teach for 5 days will be different from what you teach to the second year MBBS student if they will join us. So that is what I think you are talking about.
Sir, the 5 day that I get in regular course, or the 4 day I get in the regular course, it's enough for me to touch the important topics of pathology as asked in PGME.
Okay.
Let's take an example that when I start with chapter number 1, that is cell injury, I take the topic of necrosis. I give them the important concepts and give the examples. I also tell them these questions have been asked, say in the PGME, in AIMS or PGI. But in the second year, a student should know what is necrosis. We all know, sir, necrosis slide is very difficult to appreciate in the microscope. And I have seen students who actually go to the microscope knowing that the slide number 1 is squamous cell cancer, slide number 2 is adenocarcinoma, slide number 3 is necrosis. And they don't know how to identify necrosis. It happens in most of the colleges. Let's be frank.
In AIMS too?
Okay, let's take this question later on. So we know that. We know that before we go to that microscope. Now, why is necrosis appearing pink? Why is apoptosis appearing blue? Why does necrosis has inflammation? Why does apoptosis does not have inflammation? It has a lot to do with the concept that you can understand only if you attend a class in second year.
Because you have that much time.
You have that much time.
You have that much time. You don't have that much time, because if you read pathology for that much time in the internship or in the final year, other subject will get compromised.
Exactly.
But in second year, you have that much time.
So I get that much of time to tell them why is necrosis say pink, why is apoptosis blue, why does it have inflammation. When I go to the second chapter, that is inflammation, I actually tell them why is our hero number 1 neutrophil and why is our Bahubali macrophage for our chronic lymphocytes, chronic inflammation. So this concept I can give them when I have got 60 or 70 hours that I give in the second year. I tell them a lot how to attend a short question, how to attend a long question. I tell them how to identify a spotter.
So that means that will be different. That means, so the most I remember in my entire MBBS, the one subject that used to scare me a lot was pathology. I used to get panic attack before the pathology pre-prof as well as the pathology prof. So do you think that panic attack will also be reduced in
Sir, I'll tell you. Tell me, most of us seniors tell us the only book you should read from cover to cover is Robbins.
Yeah.
All of us. I agree. I will ask my students to ask their seniors how many of their seniors have read Robbins. So advising others is very easy when you have the
it's
same
very easy to
concepts.
give advice.
It's very easy to give advice, but you read the same thing, it's very difficult. So I make ensure that the topics of the Robins are make very lucid, very simplified, and present in the most simplified way with the best notes they can revise just for the exams.
Can you just give us some examples?
Yes, sir. I'll show you an example. For example, like see, this is a histology that you actually get in a kidney. This is a normal glomerulus. This area is the glomerulus. These are all the tubules. These area around them are the tubules. Now, when you know a first year histology, you can appreciate the second slide. That is, when you see this slide and when you see this second slide. Look, this becomes actually a necrosis. Why? So look at this tubules on the right side. They all have a round areas, they all have the round areas, and they have the clear-cut nucleus. I have marked them blue in color. But when you compare this image to the previous image, look, this again is a glomerulus, this round thing is a glomerulus, this is a glomerulus, and this area around them are basically the tubules. But now look at the color. The color is completely pink. It doesn't have a nucleus. And you can see the blue cells around them. They all are neutrophils, suggesting the color has become pink, the nucleus is lost, and there is inflammation around it. It becomes necrosis.
That's learning for me too.
When a student knows that he is going to see a pink color with inflammation, doesn't have to see a nucleus, it will always remain necrosis. Whether it is in tubule, in kidney, it remains in pancreas, everything necrosis remains the same. I'll show you one more example, sir. It comes from systemic pathology. This is very interesting for you too. Thyroid is a very important radiological question that often comes. Look, this is a normal thyroid colloids. Okay. These round things are colloids. The pinkish area are colloids. We all know they contain thyroglobulins. Now, we all have heard about papillary cell cancer. Yeah. What does papilla mean? It means the finger-like projections. Okay. So, I'm showing you a papillary projections of a thyroid cancer. Look this. So, this area is showing you this papillary projections. You can see this finger-like projections. But look at the nucleus. Very strange thing what you see in the nucleus is this white areas in the nucleus. What is it called? It is called as orphan annii nucleus. I am sure that most of the students do not know why it is being called as orphan Annie. This is the reason she is called as orphan Annie. She is an English comic character, and look at her eyes. Does her eyes have eyeballs? No. Exactly same thing appears in the nucleus of this papillary structures. They do not have the pink, the blue, the black color of the eyeballs. Because they do not have these eyeballs, hence they have been compared to the little orphan Annie of an English comic character. Well, most of us were busy reading Archie's, we haven't read Little Orphan Annie. But this is the reason. But once you know this, tell me, will you ever forget what is papillary cell cancer? It's a papillary projections with a little orphan Annie nuclei. And this is the question being asked repeatedly every time in AIMS, AIPG and in the PG exam.
So in nutshell, you get more time to build up your concepts in a much stronger way, which will help you not just in a PG entrance exam, will give you a comprehensive knowledge of the pathology as a subject, which will be useful in your clinical practice, which will be very helpful for learning the medicine and surgery in a more fun way, in a more useful way.
Exactly.
And as far as an entrance exam is concerned, it will be almost a cakewalk if you're going to start this second, because second year is one thing that is usually weak for most of the subjects, for most of the students. And I feel that second year is the rank deciding subjects for the PG entrance exam. So even you believe that it will be a very good idea to become oriented early to get close to your dream rank as early as possible.
Surely, friends. And we will ensure that you not only just pass the exam, you'll get the 75% marks which everyone dreams of in getting second year. So join us. I am very hopeful that you will all do the best. And Dr. Rajat is here and I am here to help you to achieve that dream.
Alright.
Thank you, sir.